Okay, let's do this then. I'd like to call the regular meeting of the Northern Nye County Hospital District Board of Trustees for June 2nd, 2022 to order. Would everybody please join me in the Pledge of Allegiance? I know. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, thank you, everyone. So what we're going to do is we're going to recess until I can get a third member on the board on the phone, so we have a quorum. So please relax. Thank you. I'm going to open up the meeting again at 17, what do you got, 07, 08? 17:07, and let's go to item number 2, general public comment, 3-minute time limit per person. Action will not be taken on matters considered during this period until specifically included on an agenda as an action item. Do I have public comment? I'll give you guys. Okay, so no public comment. Number 3, approval of the agenda for June 2nd, 2022. So I'm going to do a little bit of changing. We're going to move item 11 up in front of item 10 so that we can take care of it in a timely manner. And then I am going to declare an emergency item, which is for number 5. And what I want to do on that emergency item is work on what I'm calling damage control, and we'll have to vote on it. And we'll come to that when it gets there. Anything else? Do you got anything else you need? Eddie?
Nope, you're done.
Tim, do you got anything else?
No, I'm just trying to get Michael the information for the teleconference. So if you don't hear from me for a couple minutes, I'm concentrating.
Okay. Okay, so the agenda will be stand as we amended. Number 4, announcements. First, Patty, got anything?
Nope.
Okay, I have an announcement. I would like to take and welcome our guest out in the audience here. So, Queenie, would you like to come up with the doctor? And yes. Okay. I hear you. No problem. Good afternoon. Is it light? There you go. Green?
Yeah. Can you hear me now?
I can hear you fine.
Hi, my name's Govind Koka, Dr. Govind Koka. I'm a family doctor in Nevada for the past 22 years.
Can you spell your last name?
Sure. My first name is Govind, G-O-V-I-N-D, and last name is Koka, K-O-K-A. And like I said, I'm a family doctor. I've been in Nevada for 22 years. Coming here today because we like to open urgent care in the Tonopah community area. Did my medical school in Kansas City, did my residency through Ohio University in Dayton, Ohio, and then I've been in Nevada ever since. We've had clinics in Las Vegas, Henderson, and Pahrump. We currently have primary care, urgent care, orthopedic surgery, neurologists, and psychiatrists. And we have the urgent care currently in Henderson, and we have 7 other clinics in the Las Vegas area.
No, okay.
And I would like to come here and help out here.
Any questions?
So are you guys putting together a proposal for us?
We are.
Yay. Yay, 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 yay.
Okay. Tim? He might be gone. Okay, well, we look forward to working with you. Welcome to Tonopah. And hopefully we can get something going to where it's beneficial to both yourself and the community. All right, sounds great. Thank you, sir. Anything?
Where's Carlisle, C-A-R-L-A-L-E. I hope if we get a new provider, that we will be realistic, that we will work with the provider, not just for the future, but to support the provider for longevity and good faith. We've had two providers. They have not worked, for one reason or another, have not worked out. Remember one thing I learned with Economics 101. Wants are infinite. The abilities for sustainability and pragmatics are another issue. So far, we have a bad track record. So anybody that invest with us better talk to us beforehand and make clear what their short-term goals, their long-term goals, and how we can support them without conflict. Thank you.
Okay, thank you. Okay, and under our announcements, I'd like to welcome Valerie. You want to come on up? And I received an email today from the Nevada Dental Foundation, and they would like to formally request permission and add it to the contract to be able to use the sleeping quarters adjacent to the dental center for their volunteers to use when they travel to and work in Tonopah. And it says they'll develop a protocol to ensure the area is maintained, cleaned, and the sheets are washed and dried prior and after the group's departure and on the arrival of the next. So that was brought in, and can you elaborate?
Yeah, Valeria Romero, R-O-M-E-R-O. I'm Dr. Valeria Romero with the Nevada Dental Foundation, and yes, we are formally make a request for the use of the rooms that are in the Nye County School District for our staff. I think that maybe to have it available in July will be a good timing to be able to to bring our staff, make them comfortable with the area, and fill the office with all the tools that we need, do the cleaning, the deep cleaning that the office needs.
Right.
And yeah, we are making the promise that we are going to keep it in a good state.
We'll hold your feet to the fire. No problem. Okay, thank you.
Yeah, and I'm sure we'll be able to work something out there for sure.
So, any other announcements? If not, we'll move on. Let's go to item 5, our emergency item. This one here I want to call damage control. As, unless people don't know, we took over the clinic building back from CNRC on a mutual agreement. And what we want to do already, we have people saying that they heard the clinic's closed and, oh my God, we have no medical coverage now and might as well move out of town and so forth. And I've got a half a dozen emails or texts on the same thing. So what I would like to propose is that we keep Leanne Jones, who is the front desk clerk, on for the next month during the transition, because it's going to be like July 1st before we can get our new providers in. But this way we have somebody that's there that is working with CNRC and being able to answer the phone, tell the people what's going on, and do the transition. So, thoughts?
Well, I wouldn't call it damage control. You know how I feel very differently about the situation that we're in. But I will say that I have been trying to figure out how we would do a full comprehensive inventory of our equipment in that building. Melissa certainly isn't going to be able to do that. And I think maintaining and holding Leanne for that time would definitely give us that person to do that inventory and to get all of that straight and in a spreadsheet so we know what is there, and then we can tie that to those receipts of those purchases on our end. So then in the end we would have a comprehensive inventory. So I like the idea of keeping her. I think as far as those patients that we're seeing there, I do know they have been told multiple different things, not just by the staff there, but also by physicians that had visited there. So I think having her there would offer just clarity of the fact that while, yes, that contract has been terminated, the district is working diligently to rectify the situation that's been going on for quite some time. So I am in favor, actually, of keeping her. How we do that, how we pay her wages, I think we've got to figure that out. I would also like to see that she maintain insurance, which I think she will through CNRC for that month, because I think that's important for her to have that health insurance through this transition. So if she's working on both sides for us and for them, then I think that would be a fair situation for them as well.
Okay, and what happened is I talked to Vanessa Torres, who's the administrator for CNRC, and she said that they would be willing to keep her on payroll with insurance and everything for the month, as long as the hospital district agreed to reimburse them for her wages for the month. So that's what we'd have to vote on tonight.
And I would be good with that as long as we saw her timesheets. So that would be the backup. That would be the backup to their invoice. Now, for those of you who don't know, the reason she is the only one we're discussing is because she is the only one that has not got a place to go. So the phlebotomist that was working there has been gone from CNRC for 2 weeks. The other gal who has been kind of our contact, she works for DOT and was only working for CNRC on the Friday. So this one person is the only one that is totally being displaced by this, and that's why she's really kind of the person that we're talking about keeping. So she's the only one that is definitely affected with no income if we choose not to do this.
Tim, are you on? You got any comments?
Yep. Yeah, we severed a contract with them, and we don't need to pay them any more money, period. And, I mean, if they want to keep somebody there, they keep somebody there. But for us to pay that after calling for a breach of contract and after trying to sever the contract, I think that puts us in a little bit of a bind.
Tim, do you have an idea of how we might maintain that employee for a month outside of that situation with them?
I mean, we could put her on our payroll, but it's going to be a lot more expensive to us.
Well, and we're talking for us a temporary employee. She wouldn't even be a regular employee because we would not have a permanent position for her, actually. We would not have that.
And see, if we picked her up and put her on, if we put her on payroll, the only problem is how would we pay her? We have to put in a voucher, and then by the time it gets through to Nye County and they pay it, it's going to be 45 days down the road, and she works week to week like normal people do for a paycheck. That's why I suggested, and I asked Vanessa if they would be willing to do that for the month. And it helps them too, because then it makes it look like they didn't just up and abandon everything.
And I'm in agreement with you as far as that go, Tim. I don't want the tie there. I think I voiced that to Don earlier. I don't really want a tie there, but I don't know how to get around that for this 1 month of work and this 1 month of transition.
Well, here's the thing: is we don't know that it's going to be 1 month. We don't know what CNRC's next legal steps are. That building could be tied up indefinitely because it's attached to the services. And it could be tied up indefinitely if Van decides that he wants to go through arbitration and court and all that. It could be January 1st before we get a hold of that building for real and are allowed to use it.
Now, Tom Vallis seems to think that we have done our due diligence, Tim, and that building is ours as of June 1st.
Well,
and even if we had to insert
to the extent that that building is only attached to the services agreement. So we cut the services agreement, but if Van decides to challenge that through arbitration, that services agreement, it's still attached to that. So it depends on how much legal pump.
No, because what Van would challenge would be who is in default. That's all he can challenge, is who is in default. And as the contract is, as it's written, if either of us want to challenge the default, then we have to enter into binding arbitration. And through arbitration, it will be decided who actually is the one who was in breach. And for each group, for us and for CNRC, there are specific things that are laid out into that contract as to who would have to pay what based on their breach. So if we were found in breach through arbitration, we would have to pay his previous 12 months profits. So he would have to show that he has made a profit. Then he would have to explain why we have consistently received invoices that show no profit. And that's how the contract is written. If he's found in breach, then he would have to pay any of the parts and pieces for us to recruit and reman that clinic. So when it comes down to how that would part out, it goes into arbitration. One or the other of us is going to be found in default, and each one of us has a clause as to what that default will cost. But there's no avenue within the contract for him to regain and reestablish that contract.
And part of the contract does state, Tim, that the lease on the building, on the clinic building, is attached to the services contract. So if he's providing no services, then they cannot use that building for anything. It comes back to us.
And that's why Tom felt that that finding the breach, we can outline the breach very clearly, but it doesn't tie up the building because, and in fact, we needed to secure that building because it is not tied up due to the fact of our citing of his breach. And our citing of his breach has to do with primarily that piece that lines what he is supposed to provide to the public on a daily basis that he has not for months provided. So none of that. We have access to the building. It is ours now to do with what we want.
And Tim, just so you know, Nancy's online too. Good evening, Nancy. Thank you for calling in.
Yes. Oh, yes. I intended to. I just you might be late because I just got out of the dentist office. I thought trying to get to the place where I could call. Thanks.
How much of this did you miss, Nancy? Because we're talking about possibly letting CNRC continue to employ Leanne Jones for the month of June while we do the transition, and we can use her for doing a comprehensive inventory of the building and all the equipment inside during that period.
Okay, I heard that you were talking about all that, but I didn't know who you were talking about. I knew it had to be one of the employees, so it's Leanne Jones. Okay.
Now, Tim seems he doesn't want us to continue working with CNRC at all. But I think I call it damage control, because right now I've got people saying that the clinic's locked up, there's no medical services anymore, and I want to make sure there's somebody there to tell people when they call in, it's just a transition. We do have medical providers that we're getting in here.
Well, and she can help facilitate their transfer of medical records. So if let's say we bring in another practitioner, they're not going to have access to those medical records. Those medical records belong to CNRC. So she actually could help in that transition.
I think it's critically important. From what
Tim, do you see
from the feedback that I have heard, I agree with you, Dawn, that we've got a lot of, we need to do this. I think it's, if possible, it's damage control for sure.
Tim, do you see another way to do it?
I've been racking my brain on that, and I don't know. I mean, the only other way really to do it is to employ her as a temporary employee. But that would also require us taking over that entire phone system. If they're not going to provide the phones, because you remember, if they're not going to provide this phone system, which if you remember one of their last invoices said was $2,400 a month, and then you have her salary on top of that, to basically tell everybody there's still no medical provider here, as there hasn't been for the last 4 months. I don't know, and I'm racking my brain with if there's another way to do it, and I don't. Unless we did something through a temporary staffing agency that she could apply through.
No.
Well, see, and the big thing right now is it's past the first of the month, and when I talked to Vanessa, she said that CNRC has already paid her insurance for the month, so she'd still be covered under insurance in that too.
Tim, would you be okay if we formed a written agreement with them about just her and just this situation? Would that feel better?
That would probably.
I agree in a lot of parts with what you're saying about the tie.
Yeah, if it was a separate agreement to, like, for whatever you want to call it, if you want to call it transition, if you want to call it just to help them wind down operations, whatever it is, if there was a separate agreement, I think we could probably get through that.
Well, and I definitely think we call it a transitional phase, and if we form an agreement with them only solely completely about her and her situation and what she can do for them and what she can do for us, then I think I would certainly feel a lot better having it very separate from the whole situation with their provider contract, because I, like you, we found it in breach.
I like that, Patty. Yes, I think that it does have to definitely be separate. And then, because it all makes good sense, we can, justify that very easily with just what we've been talking about here in the last few minutes. Why it's really important to our constituents. It's important to, we as a board, that we do things in that manner, is what I believe. I do like that idea.
I like that too, Tim. Go ahead.
Yeah, I'm thinking out of an abundance of caution, if we might want to get an opinion by Tom, because you've theoretically drawn a line in the sand with CNRC, but this effort, if she's still employed by them, kind of extends it. You might be good to get an opinion from him if this puts you at risk at all.
Well, you can bet that's going to happen.
Yes, and we'd have Tom actually draw up this agreement for a 1 month period, and that's it. And it would be separate from the other contract completely.
Yeah.
And the other thought I had is I wonder if NICC could somehow work with you on keeping her there.
You mean the county?
He's talking about the coalition.
Oh, the coalition.
Well, probably not, because they do that for those that they're putting through school.
And the big thing we worried about, Russell, is how to pay her. Other than paying out of somebody's pocket and then trying to get reimbursed through the hospital district, that's not the way it's supposed to go. And if we put in for a voucher, we know it's going to take 45 days, and she lives week to week like most people do that work.
Well, we either have to treat her then as a contractor and form an agreement with her personally, or we have to bring her on as an employee, which is almost, we're talking, we would like to do this tomorrow, and we don't have a position created. We haven't paid workman's comp for her. None of that is taken care of. So it's really not the best way for us to go about that, to just hire her as a temporary employee.
I do think that we need just to do the separate contract with her, or however we can put that together as, as a contractor, so that we can avoid some of those issues that has been spoken about. Kind of what I'm thinking, listening to all of this.
And just to throw this out there too, just as an option, I wonder if, and I know there's lots of nuances to this, but if Queenie could pick her up and get her going. I know it's early with them, but that might be a
Well, that is not a fair thing to even just assume, because they don't even know this person. They haven't seen a resume. They know nothing about them. And so, and at the end of the day, we have work for them to do for the next 30 days. So that's not really an easy ask either. And we have no real agreement or contract with them either. So that's not really a fair thing to do. To any of those parties, because they just don't even know each other. They don't even know. So
So if we can get Tom to write up an agreement stating that we will take and pay her wages or reimburse CNRC for her wages for the month, and it's a separate contract from everything else, would that suffice? The problem is we need to get this, we need her in there answering the phone every day. And if we wait
Don, I
for
think
2
that's
weeks, we
where
might not do it at all.
that communication, it needs to be done with Tom, like ASAP, and you will have all those questions answered legally so that we feel comfortable in doing that, and so we can get going on this. If that could be done with Tom as soon as possible.
Are you ready for a motion? Okay, so I'm going to make a motion. I make a motion that Don consult with Tom Vallis, our attorney, for a transitional 30-day employment agreement for Leanne, that they construct a contract specifically for the employment of this transitional employee, and if our attorney agrees that this is an okay thing to do and CNRC will sign it, then my motion is that we go forward with that 30-day transitional employee and agreement with CNRC to reimburse CNRC for her wages and her wages only.
Okay, I have a motion.
I would second that.
Okay, I have a motion and a second. Any further discussion? Tim? Anybody? Anybody in the audience? Okay, if not, I'll call for the vote. All in favor, say aye.
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 Any opposed? Okay, passes 4-0. I'll get on it with Tom in the morning first thing.
And obviously, if Tom says, oh, no, that's a bad idea, then we're back at the drawing board.
Okay, thank you. Moving on, item number 6, trustee liaison comments. This item limited to topics, issues proposed for future workshops and agendas. Anything, Patty?
Yeah, now that we are moving forward, I would like to propose to start working on I'm calling it a workshop for want of a better word, and this is not a board workshop. This would be a medical and responder workshop, and I would like to start looking at doing it towards the end of July, 1st of August. So I would like everybody's kind of ideas on that. Is the board got an appetite for that? What I'd like to do is bring together our providers in the community, our medical providers, our mental health providers, our dental group, our EMS workers, REMSA, the ambulance service, our fire rescue, our search and rescue, get all of those folks in one room and really start clocking out what each group sees as their biggest issues, what each group sees as solutions, and how we can all work together to start shoring up this medical situation that we've got before us. So I would like to do that.
Any comment? Nancy?
Let's see. Could we see that? Are you going to put together a list of those pertinent people that you kind of were mentioning right now, Patty? Or
I will
do you
put
want
together.
recommendations from? Yeah, go ahead.
So I would put together a list, obviously, and send out invites, whether they be email. They don't have to be super formal, but send out invites for them to attend our. It's not really a workshop in like our board workshops. This would be a problem-solving workshop, so there would be a list of those that we would like to attend, both local and even those that may not live here in our community or be within our district, because there are people from the outside that can bring us some information and some different routes that we may not even know to go, and then get them all in one room and start targeting problems and solutions as they see it. You know, our EMS providers are going to have a different perspective than our medical providers. Our dental providers are going to have a different perspective even from those groups. You know, we have the town of Tonopah itself is going to have a view of how things are, and who knows who can help who solve what problem, but that gets all of our players in one room, and really the end goal is to start building team. That is severely lacking in every single one of these groups. There's not a whole lot of working together, and I really would like to start facilitating events that encourage that, and this is one of those events. It also, again, will give us some understanding of what they see as the problems and what they see as solutions that could be offered even on their own end. So that's kind of what I'm thinking, Nancy.
Okay. Yes. I thought that was where you were going, of course. And what I mean, you're open to the board to give you recommendations to put on that list as well, correct?
Yes. You guys can email me.
Yes. Yes. Okay, that's what I think. That way I feel comfortable with everybody having their input on that, and which I think that's probably where you would have been going next. But I just wanted to, because I understand what you're saying, but I do think that all the board members need to have input into that, you know, and have a little discussion about, you know, if that's really vital, so that we have a build up. But it'll all work out. That's just all. It gives some input because you've explained it very well, and all of that. That's all I think that I wanted to share for my behalf here, because it's important that, you know, that we all, know people that we feel we might.
This activity would fall in line with our CHIP in some ways.
Yes.
So that's why I didn't bring it up as an agenda item per se, because it does kind of fall in line with our CHIP, which we have been pretty neglectful of.
Sure. Okay.
Tim?
Yes, Don.
Tim, your input?
I don't really have much for that. You know, if that's an initiative Patty wants to pursue, then I'm sure it'll all go fine.
Okay, what I'd like to add to it is, if we're going to do this, I would like to possibly put on the reader board in town, and maybe a newspaper ad in like Bishop, Ely, our local areas that have medical coverage too, and see if they can add anything to it. I mean, more heads to put together. Comes up with some ideas. Go ahead, Nancy.
Yes, well, I think, especially if we're trying to reach to some of the smaller areas that have already dealt with some of the things that we will need to be very much aware of. And it seems like it takes time sometimes to realize all those things. So I do like the idea of getting Bishop, County, Ely, any of those places, Panaca, wherever it is, and see if they would not want to come. And we might have to compensate them somehow or other. I don't know, with mileage or something. I'm not sure. But those are all very good ideas to have these professional people that have already been there and are currently doing it. And that's what I'd like to hear from as well. And what about Russell to be in all of this too? Because isn't he one of our people that coordinates a lot of this stuff for us? And he can take on a lot of these responsibilities, perhaps, to get this accomplished, so that it doesn't just fall back on a board or two members of the trustees. Is that something that Russell would be involved with? I thought he would be, perhaps.
Probably not. Probably, he would attend, I'm sure, but probably not as far as organization. And remember that we don't want this to be a great big bureaucratic mess of nonsense. We definitely want to make sure that our local providers are heard and acknowledged and part of the solution. So having outside, I agree with the outside help, but I definitely don't want it to be a bureaucratic situation. I want them to be able to work in their work groups and come up with very clear and concise solutions to problems they're going to already identify.
I like that.
And let me stop real quick, because I think you're talking about two different things. But you don't want this to be right now, early on, a very heavy outsider-heavy thing, because it may conflict with the problems that we're trying to identify first.
You got it, Tim.
So you might start with, I don't know, an afternoon lunch or something like that, where it's just the locals, and then maybe they work on a couple problems, and whatever's left over, maybe we farm out and see if somebody else has some answers to it. It might be a couple-stage process, but I think we let Patty kind of run with it and see how she makes happen, and make sure that it's just kept small early on. That way it's not too large.
But Tim, I don't know that we're going to be wasting a lot of time if we do not have some input, as Dawn had mentioned. And I felt that the only reason I thought of Russell, because we're just individual, and maybe that's a little bit, we've got to be very cautious as a trustee, as far as I'm concerned. But we have somebody that we pay to do like, we do when we have any of these summits type of thing on. Because we don't want to just be twiddling our thumbs either. It's good to bring them all together. And who knows how many of these outlining areas are going to send a representative that really can help us. But it still would be nice.
We don't want,
that way we're not trying to be withdrawn.
Nancy, we don't want outside problems. We don't want outside problems. We want Tonopah problems first.
Well, that's fine, but I still
agree with Tim. We should do it local first, and then
that sounds
and then
fine.
if we identify problems that we need help for.
Well, and Nancy, please remember that Russell is trying to work with the Nevada Hospital. Help me out there, Russell. The Nevada Hospital.
The rural, I think.
Yes, the rural hospital partners, and those will be the people that really, from that bigger conglomeration of rural Nevada,
that's right.
Those folks are going to be our best resource there, for sure, in the avenue and the direction that you're talking.
Right.
Where, so I think that
Patty,
Russell's already kind of working on that side of it.
Okay, I wanted to step back. Dawn kind of mentioned it, and I thought, well, that is good to get the outlining people too. But Dawn mentioned it, and I do now. I'm glad that somebody stepped up and remembered that Russell. That is what he's doing, and that is perfect. And I was happy about that. So I think it all sounds good to me now that we've all brought all that out. So we've discussed it, and our constituents know exactly what Russell is working on, which is real vitally important, as well as what we'll be doing on the more local basis. That all sounds like that works together real well, as far as I can see anyways.
Okay, and we need to make sure we approach this and we don't violate the open meeting law or whatever we're going to do. So
Correct. So,
Absolutely.
as a group, I mean, I don't necessarily even know that we need our full board there. I don't necessarily think that we need that. We're not making decisions. We're gathering information.
okay.
But it would be good if the full board was there, though. That's why it should be public. It's because, like you say, that we don't, or however we can get around that. Maybe that's another issue for our attorney. But if possible, it would be good that everyone is on this, so we don't have to try to get it secondhand. Be just right there, what's going on with all this. So that might be needing to be run across the attorney as well.
Correct, Nancy. We just got to make sure that at this meeting, it's just an information exchange, not something that the board would vote on or consider putting money into.
Right. No, but what I mean, if every trustee wants to be there, I think that should be absolutely, that should be perfect. That shouldn't be a problem if we handle it and advertise it as such and know what the deal is, like a workshop that we're not going to make any decisions on or just want to get feedback, right? Or input.
Well, and at that point, Nancy, each one of us would be a facilitator of a group. So you would simply facilitate their thought processes. You would be their secretary in a sense. So there is a job for board members who do show up because they will be the facilitators of those groups.
Right. Very good. I just wanted to be up there that this is how we would handle it, whether that happens. No one knows the time and the date and all of that, but I just think that that needs to be known that is we're very open to, work together as a board on that. And like you say, that'll all come together.
Okay, so we'll let Patty come up with a plan on that.
Gotcha.
Sounds good.
Do you have anything else, Tim? Nancy?
Not to me. Thank you.
Just one or two things here. Well, probably just one. A couple of little minor things came up when we had our meeting with the USDA. There's some early on decisions that we're going to have to start to begin to make here very shortly before we get to the USDA application. And those little bitty decisions are going to come up, I would say, probably within the next month or two, so we can start working through that process. So those are going to start to pop up on the agenda. There'll be small organizational questions that have to be answered. And between Russell and I think we'll take those back into the agenda very shortly.
Okay. Anything else? If not, let's move on. Item number 7 for possible action, discussion, and deliberation. The minutes from April 12th or April 21st, 2021, the regular meeting. So did these get out? Did everybody get a chance to look at the minutes? Patty, you got them in front of you. I see them in front of me. I've had a chance to read them. Tim, Nancy, you got any questions on the minutes for the 21st?
No, I read over them this morning. I'm all good.
Nancy? Okay. I'm assuming we have no comments on that.
I will make a motion that we accept the minutes for April 21st, 2022. We accept those minutes as they are presented.
I'll second.
Restate that, please.
I need to restate that because my microphone wasn't on. So I make a motion that we accept the meeting minutes for April 21st, 2022, and that we accept them as presented. Tim has seconded that motion.
Okay, I got a motion and a second. Any further discussion? If not, I'll call for the vote. All in favor, say aye.
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 Thank you, Nancy. Any opposed? Passes 4-0. Okay. Item number 8, no action. Presentation by lobbyist of Washington, D.C. of all recent activities performed on behalf of the district in accordance with the contract for federal government affairs services as approved by the district on September 17th, 2020. Good evening.
Hey, good evening, everyone. Good evening. This is Michael Blake Bezruki. My firm will be sending over a written report following this call as well, kind of detailing out everything else. But I did want to flag a couple of highlights for all of you. As you know, the Defense Department grant, the CIP grant funding period has now opened. And so we're supporting Dr. Russell as we prepare NNCHD's application for it. Our team is now following up with each member of the Nevada congressional delegation to secure their letters of support as we had planned. Our team has worked with them this past year, and so they're all very well aware that we will be asking for this now before the deadline. So we'll need these letters together. And so I think that will expedite the process for their internal review. Congress is currently in recess, but they'll be returning on Monday of next week. And so we expect to have these meetings finalized by then. And additionally to that, we're also supporting Dr. Russell with the HRSA application to secure the $2 million earmark that was allotted in this past appropriations bill.
Okay. Anything else?
Those are the updates for this week, and then, of course, we'll be sending our written report, too.
All right, sounds great. And I appreciate you helping us with this.
Absolutely. It's been a good several months. I think we're very well prepared, so we're looking forward to this.
Hey, Michael, I have a question for
Any
you.
questions?
Certainly.
So earlier in the week, I talked to Jacob about a CMS policy. Did you guys get a chance to look into that? I hadn't heard yet.
Yeah, I actually just came back from vacation. Jacob briefed me on that. So we're looking into that CMS policy and talking to the Hill as well. We haven't found any, I believe that we were looking for a specific piece of legislation or regulation on this that you would reference to him, and we were going to follow up and see if you had any more details on that. We haven't found anything yet, but we're going to continue to reach out and see if there's any possibility to find some solutions for this, particularly with the ambulance service too. So we'll have an update on that shortly. But we haven't found that piece that you had referenced before, but we're looking into it.
Perfect. And just so you guys in the board are aware, as you guys know, RIMS is prevented from billing. It has to go through Nye County, which in turn increases the amount of subsidy or the amount of payment we make for RIMSA to do what they do. And that's a CMS policy rule. So I asked Michael to look into it to see if we could form a position and start lobbying for a change to that rule so that RIMSA could bill for what they do on a daily basis, and that would lower the amount of money we actually pay to RIMSA.
Okay.
So, Don, this is Russell Pillars. So I had heard from Kevin at RIMSA at one point that they actually had the CMS rule changed to accept community paramedicine. It just wasn't going to take effect yet. So you may want to check with him if he knows what the latest status is as well.
It's a different rule. It has nothing to do with community paramedicine. It has to do with what they call the paramedic intercept, which is when the paramedic goes and meets an ambulance on a 911 call.
Okay.
And our team can reach out to CMS too for clarification on that as well, and we'll come back with some more information.
All right, sounds great. Anything else, Tim? Any questions?
Nope, we're good. Michael and I have talked a little bit, and Jacob have talked a little bit back and forth. I think we're moving in the right direction with everything from HRSA to the DCIP grant. Everything's kind of flowing fairly well.
All right, sounds great. Okay, Michael, anything else from you?
That's it. Thank you very much.
Thank you, sir, and have a good weekend. All right, let's move on. I'm going to go to item number 11 for possible action, discussion, and deliberation to accept, amend, and accept or deny a rough budget for the sole purpose of completing the design-only HRSA CDS $2 million application. Russell?
So Don, actually, I'd like to do my slides first. So basically, I wanted to swap 10 and 11 is all.
Okay, so let's change it then. Let's go to number 9. Let's go to number 9, presentation of monthly report for BioWorks by Dr. Russell Pillars.
Great, thank you. I really wanted to be down there for this meeting. We have an awful lot going on, but I was there for JB days and the thought of turning right back around seemed a little quick. But so let's go ahead and go forward to slide 3. So you'll notice there's an awful lot of things going on. My slide deck is growing, and this is even after I've taken a few out. So let's go ahead and dig in. I'll start with the Whipfly things. So go to slide 4. So this is their update they provided to me on the examined financial forecast. So if you remember very roughly, they broke their effort in this examined financial forecast, the very first thing we contracted them to do, into 2 phases. So the first is the market demand analysis, and that's almost done. They'll, at the next meeting, they anticipate they'll be able to give you a full presentation on that data. And then it will include things like you see on the chart there. So inpatient discharges, days by bed type, procedures, ER visits, primary care patient visits. So again, they were able to finally wind up with some decent data. And that part of that analysis will drive things that you see there on the right. Ultimately, how many rooms we need, patient beds, ER rooms, clinic rooms, etc. So exactly what we were hoping from them is about to be handed to you as far as that analysis to start to let you know how big the facility is going to need to be. So then go to next slide, slide 5.
Russell, I have a question.
Yeah, go ahead.
As they are studying these numbers and getting ready to present to us, they're looking at our old numbers to create the prediction for our future. Is that correct?
No, not just that. So yes, they do take those old numbers into account, but it's a pretty impressive process that they do as far as looking at current trends, state numbers, national numbers. It's an honest-to-God, hardcore market analysis. They didn't just look at the old numbers.
Okay, thank you.
You're welcome. Okay, so let's go to the next slide. So slide 5. So then, once they have that, their next big step is the debt capacity analysis, right? So that would be part of the second phase of that initial examined financial forecast. So that initial market analysis, then they will take that, compare it to how much they will envision you actually making from the effort, right? So how well will it be sustained? So even if, just throwing out numbers, let's say the market says you need a 24-bed facility, but when they take that look at your debt capacity, maybe that will dictate all you can afford to build is 12 beds, right? So that's the phase they're just getting ready to start. So any questions on that?
Nope.
Okay, great. So let's go to slide 6. So if you remember, so we had just contracted with them the 2 separate analysis is the long-term and memory care market assessment is one of them. The space program analysis will be a part of that second effort that I just talked about. But this basically senior care analysis is they've already finished the market demand part of that, and that will be compiled into the presentation they give you at the next meeting. So just so you know, that analysis that you contracted them for is already almost done. So any questions there?
I got none.
Okay, so let's go to slide 7. So this was, Tim touched on this briefly. So Don had asked for a meeting with USDA to get an idea of what our funding options through them were. So Beck Environmental, did a ton of work. They actually spent quite a few hours getting that meeting arranged for us, and it was extremely helpful. So they had not only their Nevada state folks, so Gus Wiegand, their director, as well as Miss Maria Murillo from Elko, but they also had the Western Regional director of one of their financial analysis components. She was supporting the discussion as well. Ultimately, what came out of that is, even though right now we do not know how much, if any, USDA funding you will need, we need to do this pre-application and get that started, because we're not too far ahead of them, but we're just barely a bit ahead of them as far as in our process of working our way down the path. So I've already started the process of working on that pre-application. One of the key initial tasks is getting the preliminary architectural report that we had Cordy do. It's out of date. So not that we need to redo the whole thing. We just need to update it, and I have a call scheduled between Cordy and USDA on Monday so that Cordy knows exactly what USDA requires. That could be free to us or very minimal. I don't anticipate that being another big contracted effort on the preliminary architectural review. So that's a key part of that pre-application. But I will just start as able. I will start working through that pre-application and gathering all the data for that. So any questions on that?
Nope.
Great. Okay, so slide 8. So in the application I'm working on right now for the HRSA congressionally directed spending, so that one is due on Sunday. So it's been moving pretty fast and furious. There's an awful lot to it. So I hit one section that needed, even for this, it needed some environmental input. And I reached out to Eileen at BEC, and she said, her response was, she was very sweet about it, but Beck has already donated an awful lot of hours to us. Part of it was that meeting with USDA and some other things. So she said about 84 hours they've donated to us. So what we need to do, we definitely need this consulting kind of role at this point. Practically everything we do is going to need some sort of environmental guidance. It can be as simple as knowing which box to check, which could be really critical. Since they've already done an awful lot of work, they know that hospital like the back of their hand. I would like, and this isn't an agenda item or anything, but I would like to start to talk about the idea of bringing them on as a consultant. I know that, you know, the idea of another one concerns you, but this one we will not be able to do without. Well, actually, any of them we can't do without. But so ultimately, we're going to need big things like phase 2, EPA phase 2, things like that as we go through the pre-construction and construction. But for now, I would like to start noodling on the idea of if Eileen could give us a proposal to just support us in an hourly rate. So if you want to talk about that right now.
Yeah, I believe if we need, you know, I understand that Beck Environmental has donated a lot of hours, and we are really appreciative of that. So I think it would just behoove us to go and talk with Eileen, see if they can come up with an hourly rate, and they're good with it, and then bring it in front of the board, and we can just vote on it and get that. So we've got them as consultants. So yeah, I'll move forward as far as I'm concerned. Patty?
I would agree. I think there will be times we need that. I don't think we're to where we need them on a full consultant basis, but if we could definitely do an hourly, that would be awesome.
Perfect. Thank you all.
And I also agree with that.
Okay, thank you, Nancy. Tim, your thoughts too?
No, I think you guys are right on, and the other part of that is we know that there's another, from just talking with Eileen, we know there's another bunch of money that just got dumped for that phase 2 environmental assessment. They're going to be like the people to have to be able to get a hold of that money. So it just makes sense to have an environmental company on board with whatever we need to get done with the construction stuff.
And they're awfully
Okay,
good
so
at
we're in
being
agreement,
able
Russell.
to-
Go ahead and move forward.
And they're also very good at being able to access that brownfields funding as we need. So, okay, so let's go on to slide 9. So just real briefly, there's not a lot to expand on. So everything that I'm talking about, Brett, that's on the screen there, he's guiding me and making sure I'm doing the right things. So just that's a general update for Sixco. If you want to ask him any questions, he is here.
Any questions? Nope. No, we're good, Russell.
Great, thanks.
That was
He
easy.
will,
Okay, thanks.
we'll probably have need his input on one of the other agenda items as well, but we'll keep going. So let's go ahead to slide 10. So this is the other agenda item. So I won't go into it now, but so the criteria architect, I know we've talked about it. Feel free if you still don't completely understand what their role is, don't hesitate to let us know. So again, that's a separate agenda item tonight, so I'll dig into it then. So let's go ahead and go to slide 11. So the care model consultant, I know we've talked about this to some degree, but I'm completely understanding if you don't quite understand the role yet. And I'll go ahead and explain it a little bit more as I'm learning more about it myself. So in a normal, typically what you see across the country right now is with construction of hospitals, you either have a replacement hospital or a hospital addition / modification, right? So in those scenarios, you have a staff, an operational staff, director of nursing, ER, all of those things, they're in place and they're working. So as you start to work through your design and start developing your criteria documents, you have those people that can guide the myriad of decisions that have to be made at that level, right? And so your criteria architect, they could make those decisions, but that's not what they're good at. Brett's not good at it. I'm not good at it. So you really need this person. So in my icon there, you see, okay, so we're kind of weird. And Tim verified this for me too, that across the country, what we're trying to do, basically a greenfield hospital, is a little rare, right? So that's where this person would come into play, and they will help you make that literally thousands of decisions that need to be made as you go through and lay out your criteria documents that the design build teams will compete against, right? They will use that to lay their foundation and give you proposals. So an update, you had given Brett and I kind of the mission to go forth, and we're still working on that. We have the scope of what that role would be very well defined. And again, we're flexible, whether we can find a person that's long-term that would come in and basically be something like your chief of operations at this phase, going all the way through construction and then into operation for years to come. Or if we need a consultant, a phased consultant that as we go along, they would be there to answer the questions for us. And we are in the process. We've identified 2 individuals so far that would be excellent for this. We're not done. We would like to give you kind of a handful of people to look at for this role. And So again, I know the taste for this is difficult, but the experts tell me the earlier we have this person in place, the better. So if you want to chat about that, we can.
Russell, I don't think we don't understand what this person does or what this role is. I think we understand quite clearly. I think it's all about timing for some of us, but it certainly is for me. I don't want to have a consultant that we're paying when we still do not know how we're going to pay for a building. So there are things I can see that we're paying for now that we don't necessarily have a plan to build tomorrow, but we need to get this other stuff done. But this care model consultant, I think timing is what haunts me the most. Because if we bring them in too early, what are they going to be doing? That's number one. Number two, we do not have the funds to demolition and to build. That money's not there. We don't see that in sight. So until we have a good plan of that or a good idea of that, I think that for me is where I am hesitant to do anything more than investigate this situation.
Well, hey, let me chime in for a second.
Go ahead. Yep, go ahead.
So we are not going to not only not have funds in place until it's demo time and after all of this stuff is already taken care of. We have to get through the design build competition to know what it's going to cost us. When we know what it's going to cost us, then we go to the USD and ask them for whatever we're lacking. So that the idea of knowing where the funds are going to come from is just not a thing that's going to happen until it's way too late for this person to be there. This person has to be in place to make the decisions on what to build. And I know it kind of seems like a timing issue, but it's just going to be one of those things where we're not going to have the information needed to put the design build competition together without this person. And without the design build competition, we don't know how much money to ask the USDA for on a USDA loan.
Okay, I understand, Tim.
Yeah,
What I was worried about, and that's why I asked to have that USDA meeting, was exactly what happened with Corte. Tell us what documents we need. Tell us if they have to be timely and if they expire. So that money we spent for Corte, it was money well spent that we needed to get done, but now it's out of date. So I don't want to have to spend that money again to get the same doggone results. So that's why I wanted to ask and find out, what do we need, and then what kind of a timeline frame can we put them together where it all comes together, where we're not re-spending money. Does that make sense?
Very much so. And so, Patty, you've communicated your concern, and I think it's an extremely valid one. And so we've talked a lot about it on the team as far as I want to make sure we are able, we as your team, so me, Brett, EAPC, if we bring them on, your whole team, to explain to you, so to give you some insight on how the experts see that this is going to be funded. Right, so you have a lot of options out in front of you, whether it's grants or the Nevada ARP money or USDA. You have an awful lot in front of you. I think the bottom line that we would all agree on is you are far, far, far from being limited to the money you have in the bank right now. But we need to convince you. We need to show you how we can move forward. And I totally appreciate that. And we're setting that as a goal to, in the next meeting or so, have actually an agenda item where we can have some experts explain to you the different options you have, whether it's developer-led funding or all the other options that, to be honest, I don't understand them all, but the experts do. And so your concern is very valid. And we heard you very well last meeting in that between the two, pace, so going fast versus being able to pay for things, you will pick the pay for things every day. right? So we heard that message, and not that we're going to slow down necessarily, but we will make sure everything's in place. It is in nobody's interest to overextend the district, right? So the timing is good. We're going to start getting numbers from Whitley to show us, what we, ideally the market would need and can support. And then soon thereafter, they'll have your debt capacity analysis to tell you what you can actually build. So I think the timing is still good. And you'll notice I don't have, a separate agenda item to actually hire this person yet. I just wanted to keep this in here so we keep talking about it, that as we can fund these things, that we're ready and everybody understands.
Thank you, Russell.
Okay, so any more questions on that before I go on?
Not from me.
Okay, great. So let's go to slide 12. So again, just kind of a slide placeholder, if you will. So the PDP, so Progressive Design Build, PDB. Oh, it's supposed to be PDB. Sorry, I screwed that up. Anyway, so that process, we're ready. The language for the RFQ/RFP that we will eventually publish as a template for design build teams to compete with is in legal review right now. I sent that off to Ted Krissinger, so he's looking at that. And so that's just another string that we're working towards, because I think, and Brett, correct me if I'm wrong, we were hoping to be able to publish for that competition in July, August?
That's correct, yes. That was our hope or intent. Mm-hmm. And I think Ted was starting to make himself a little bit more available as we've gone back and forth on exploring the language of that. But he was pretty busy at first, but I think his time's loosening up so we can meet that date.
So any questions on that before I go on?
Nope.
Okay, so slide 13, you've already talked about the dental process. I'm thrilled that that's moving forward, and I'm just excited to see all that come to pass. It sounds like I was told that this coming weekend they're going to be in there trying to finish up on the lights and the machinery install. But now you have that great local contact that can give you the very latest updates. So that's great. Okay, so slide 14. So the Air Force houses, last meeting, you directed me to investigate what it'll take to return those. So that's well underway. I reached out and they were with us. They were sad that it didn't work out, but however, they started the process on their end. And I want you to write down this date, if you will. So this just happened late this afternoon. They are going to send someone they need to inspect the property on July 22nd at 10:30 in the morning. We'll need someone that can meet them, whether that's Melissa or one of you folks, with keys. So they just need to look at them and make sure they're still the same as when we got them. I guess I just told the lady they're 2.5 years older. That's pretty much it. So that's well underway. So any questions on that?
Do you know what date that or what day that is, Russell?
I believe that's a Wednesday.
I haven't.
Find out who can be here, and if not, I can take a day off to be here.
No, I have it as Friday, and I'm available too. So I think between the two of us, we
Okay,
can take
thank
care.
you, Tim. Okay.
No, so, did I say July? It's June 22nd. I'm sorry. So June 22nd. Sorry, my bad. When he said it was Friday, I knew I had said something wrong. Yeah, so that's a Wednesday.
I'm still available, so we're okay.
Okay, thanks, Tim.
Okay, slide 15. So again, the application for the HRSA CDS is due technically 5 o'clock on Monday, the 6th, but I'm going to get it submitted this weekend. It's been a pretty heavy lift. It's taken almost all of my time. But again, I think we're in a good place for that. And one of the separate agenda items, as Patty asked, is the budget. I'll be attaching with that to let you look at that and approve that. So everything's, ultimately at the end, that last budget, so the funds will need to go to Nye County, and there's obviously lots of federal regulations on how they manage those funds. And so I will reach out to Nye County and start that process to make sure they're ready. I know they do this all the time, but I want to make sure they take care of your money. Things like it has to be in its own separate account. It can't be lumped in another account. It has to be separate so they can track exactly how the money's spent. So that'll be some work on our end to make sure, you know, they're working with us closely. So any questions on that?
Nope, we're good.
And again, anticipating those funds could arrive in August, late July, August. Okay, so let's go to 16. So the DCIP application that Michael talked about. So I've started this application, but in contrast, so the HRSA application, I don't want to understate it, but it is for the most part a placeholder. They just want to have some rough estimates of what we're doing, and we were able to define that as quote unquote design only. So only the pre-construction phase is all we had to nail down, and that's what you'll see in the budget. Whereas the DoD application will need to cover the entire project. And so that's going to be a much heavier lift. And that's where I may need Michael Bezruki's help with some of the congressional offices and things like that. But that's due July 18th. So as soon as I can submit the HRSA application, I will be able to dedicate all of my time on the DCIP one. So yeah, so any questions on that?
No, it sounds like you're going to be busy.
Yeah, my workload's gone up quite a bit, but that's okay. That's why we're here. Okay, so let's 17, again, just a quick update. It's still like tonight, you see we have 3 of us on the screen. It does work, but I know the county doesn't want us to do it this way. So I'm still working with them on how to figure out an alternative solution. So essentially nothing new on that. So let's go forward to 18. And so Patty asked for my quarterly snapshot is what I'm going to call it. And I would like to deliver that to you in my next report. So that'll put me in sync with the quarters. So that'll be after month 6. So I don't have one now, but I'll do that next report. So that is all I have, if anybody has any questions.
Jim, any questions?
No, Russell and I have been keeping in pretty good contact over this process and between the USDA stuff and all that, so I'm good.
Nancy? Did we lose her? Okay. All right. Thank you, Russell. So that is item 9. Let's go to item 11 for possible action, discussion and deliberation to accept, amend, and accept or deny a rough budget for the sole purpose of completing the design-only HRSA CDS $2 million application. We're yours again, Russell.
Okay, so Melissa, if you can put those slides up and then go to slide 2. Okay, So again, I touched on this, and I just want to reiterate this. It's really important to understand the budget that I'm going to throw in front of you only has one purpose. It is to complete this application for HRSA. So whatever numbers you see on that are based on a rough estimate of a $50 million facility. We just picked that number. We have no direct information at this point that that's how big the facility will be, but we picked that as just a baseline to work with. So go ahead and go to slide 3. So here's the budget. So again, the question I have that I'd like you to vote on is if it's okay for me to use this budget in this application. Now I'm ready to go through and describe each of those things to you. So the total pre-construction budget, roughly, as we've looked at it for a $50 million facility, is $4.4-ish million. Okay, so again, we're looking to just show the government, so HRSA specifically, that A, we have a well understood need for the $2 million, and these are the kinds of things that will be spent on. So if you want me to go through and talk about each line item, I can.
Russell, I just want you to tell me what AE fee is. Is that the architectural engineer?
Yes, so that's the architectural design. So imagine you would have selected a design build team, and so before construction, that's the cost of them actually doing the drawings, the actual effort to design the building. So not just doing the drawings, but actually going through. They would be working very closely with EAPC, your criteria architect. They'd be working very closely with your care model consultant to actually do the drawings. That's what that's for.
Okay, and one other question. I knew when we were talking about the use of this money, we thought that we could use some of it for the demolition of the old hospital building. Is that still possible?
So the way, because the cost of the demolition was so high, in actuality, the way the team has decided we would like to lay this out is initially, way back in the day before you had a team, I was thinking we would do the demolition first before you even did a design build competition, right? But the wisdom of the team says it's probably better to have that as part of the construction. So your design build team will actually manage that demolition. So technically, that would be an expense during construction, not pre-construction. That's why you don't see it here.
Okay.
So ultimately, to pay for the demolition would be part of the overall cost of the entire project. So whatever funding mechanism you leverage, that the demolition will be part of that.
Okay, fair enough. Any questions?
Hey, Russell, correct me if I'm wrong, but because this is just part of this placeholder application and all that, it's really kind of a non-binding budget in the first place, right?
Yeah.
It is about as non-binding as you can get. Yeah, I can't overstate that. This is really, it's even more than a swag. It's just rough numbers, and we can back them up. So we had to do work as a team. I couldn't just pull numbers out of the ether. These are based on, some numbers. Again, that $50 million effort, but I can defend this to the government if necessary. But for all intents and purposes, it's a placeholder, and the HRSA office, CDS office, has told me directly that if we need to make changes after we submit the application as we start the process, they're completely fine with that, and to the degree that they expect that you will adjust your budget as you go.
Right. So really, really the only thing that they generally expect in a lot of these is the after the funds are expenditure report, pretty much, right?
Correct. There are federal requirements of reporting Yeah, so even once we get the 2 million, and in my budget narrative, I will have to lay out, so the delta between the 2 million and the 4.462, I will have to describe a little bit how we will fund that. Again, that's not critical, whether we use internal funds or other grant money, that's okay. But yeah, so we will need to report on this, and that's why establishing that good relationship with the grant people at Nye County will be really important.
Okay. Well, if nobody has anything else, I'm ready to motion to accept it as presented.
Okay, that's your motion, Tim?
Yep.
I'll second Tim's motion.
Okay, I got a motion and a second. Any further discussion? Nancy, do you have anything on this?
Terrible. I think we lost her.
Okay, so I'll call for the vote. All in favor, say aye.
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 Any opposed? Nancy, I'm going to put you down as a yay, so we'll call it 4-0. Motion passed. You're good to go, Russell.
Great, thank you. Yeah, once I, as Mr. Jabor mentioned last time, once I get it submitted, I will, if you do the gun meetings, it's kind of a complicated online PDF process, but I think when I'm done, I can get a copy of the entire application and I will send it to all of you so you have it.
Okay.
So that's the end of that agenda item.
Okay, let's move on then. Item number 10 for possible action, discussion and deliberation to accept, amend and accept, or deny a proposal by BioWorks and Sixco, Nevada to have the Northern Nye County Hospital District enter into a contract with EAPC Architects Engineers to perform critical architectural services related to the construction of a new hospital facility in Tonopah.
Okay, so I guess you can't see him on the screen when she puts up the slides. That's okay. But so with us already, you've heard from Brett Mitchell from Sixco, but we also have Mr. Stanley Shimke, who you met. He came and presented the original EAPC introduction a few meetings ago. So he's here to answer any questions. So she has the slides up. Let's go ahead and go forward to slide 3. So one more, there you go. Okay, so you have the full contract in your backup material, and that has been through legal review. It's done as far as Mr. Krissinger's considered. And so let me reiterate here, EAPC's fee is defined by the overall cost of the facility. So what you see here so that's a snippet out of the contract. You'll see there at the bottom, for a $30 million project, their fee would be around $817,000, somewhere around there, maybe plus expenses. I can't remember if the expenses are in that or not. So, and Stan can do a much better job than I of explaining so how the 32% and the 8.5% work. So I'll go ahead and hand it over to Stan, and he can walk you through any of that and answer any of your questions.
Hi, everyone. This is Stan Shimke with EAPC Architects. Yeah, just what Russell had said. So we just had an example of that in the contract there of the $30 million. So the 8.5% of the $30 million, there's a dollar amount, and then that dollar amount, 32% of that is what our fee would be.
So do any of you need any more more explanation on what role the APC would fill at this point. And so if we, all things being equal, we would like to get them going right away. Now they would be paid in monthly installments. Oh, sorry, sorry, sneeze. So monthly installments, and at a conservative guess, their role would stretch for about 24 months. So they're involved all the way. So that the big part of their effort is pre-construction, helping the team assemble and guide the development of the criteria documents that your design build competitors will, be basically designing to. So they will be developing those. And then during construction, they provide a QA QC role to make sure you're getting what you intended. So at the end of the day, it's important to understand that EAPC, or whoever your criteria architect is your representative. They represent you and defend your interests in this whole process, and that's really critical to have someone in that role. So if you have any other questions, now's a good time.
Russell, is this document that we have here, is that meant to be the final contract? Like this would be the final executed if we voted and signed it tonight?
Yes, ma'am. So I understand. Yeah. So it's a little different looking. This is the way a lot of these are done. So it's an American Institute of Architects standard template that us and the legal counsel went through and modified. So go ahead.
It looks pretty messy. So there's items that are struck, but they're still part of the contract. So why were those left in?
So your legal counsel recommended we leave those. Yeah, totally understand. This is different than what I'm used to as well, but this is an industry standard. Because if we go through and go to clean it up at this point, all your numbering is off. So it is, at least from your legal counsel's perspective, what you have in front of you right now is a robust, satisfactory document to move forward with legally.
Okay, Russell, do we have total amounts, or is that total amount of the contract going to be based on what we come up with as a total expenditure for the hospital itself?
Correct. You don't have totals right now, and I understand that's a little awkward, but because they will be, once WIFLE generates the numbers and we all agree on the scope, this is just how this is normally done, and these guys can weigh in. But their fee will be based on the total cost of your hospital.
Tim, you got anything to weigh in here?
No, I've read over this.
Coming across.
Is that it's most everything says it's all pretty standard, and I'm in favor of it. So
I just wish we had a total amount.
Yeah, I don't like. I'm with Don. I really hesitate because we have no idea. It's like writing a blank check. We don't really have any idea what this might cost, and that's a worry. And you can say it's the standard all day long, but we do have to look at our little checkbook, and we got to figure out, okay, if that's the standard, what is it based on, and can we in fact afford it? So I don't know. It's just kind of worrisome.
And Russell,
that's why I was going to say real quick, that's why I did even though I know the budget isn't, binding, it's not, but I did kind of want to show you that $2 million will pay for their services until we get final funding in place. And I know it's just my word, and maybe Brett and Stan can weigh in on how this is normally done.
Yeah, what you end up with is unfortunately, I hear your concern, Patty. What you end up with is a chicken and the egg scenario on these, because when we get to a progressive design build competition, and that's why we have set a target value. We always start these processes with a target value, and Stan knows that, with this target value, we've got a pretty good sense of what his contract costs are going to be. So, we're going to watch it pretty closely, and it's never going to get out. That's what we do all day long. We make sure that costs are controlled, and we understand that they fall within the budget of the project, and we understand the fiduciary responsibility that we have to the board. But what we end up with is, if we don't put our best foot forward on at least the performance guidelines and criteria architect, it's that chicken and the egg scenario. When we get to an RFP for progressive design builders, they're going to say, well, what do you want us to price? And we don't, at that point, we won't have anything to put forth. And so we have to do some work ahead of time based on what we think is the target value. So they're going to translate all the data from Whipley into a performance standard and more of an architectural flair, and that's going to be the presentation of data in an architectural format to our design builders, and with that, then they can develop for us in GMP. Without that, our progressive design builders are going to say, we don't know what to price, and so it's part of that, prepping for GMP, guaranteed maximum price, that we have to do to put our information forward.
So right now, what are we anticipating as far as total cost on construction of a hospital, or what we're planning on constructing?
So that's the challenge, Don, is until we have the numbers back from Whipley, we can't tell you what that number is, and it will be, so they've done the market study, right? So they're finalizing that. So they're getting a pretty accurate sense of what the market, including that whole area, needs. Then they're going to look at how much you can afford. So those two things combined will ultimately give you the cost, approximately. Is it 30 million, 40 million, 50 million, based on the number of beds, right? So we don't know yet. But the problem is we really need to get EAPC working. And I'm assuming their contract is a 30-day, if for some reason you feel like they're starting to burn your money too fast, I think you can stop them at a heartbeat, right? Am I wrong? Anybody?
Well, and presumably, Russell, not presumably, we do have cost containment. And I know that's the concern, is cost containment. But we do have cost containment in the language of the contract based on the notion that a standard architect is 8.5%, and they're 32% of the 8.5%. It's going to come down to whatever the board decides on the scope of the project and the Whipley recommendations. If it's 6 beds, then it's presumably $2 million per bed for 6 beds, whatever that project cost is going to be. Let's just say it's 20 million. I don't know, I'm making that number up, but we know that EAPC is only going to cost you 32% of 8.5% of that 20 million. If the board decides that we want to go the full critical access care hospital route of 25 beds, and let's say it's 50 million, we know that our cost containment with EAPC is going to be 32% of 8.5% of 50 million. So in that respect, we don't have an exact dollar amount, but we do have cost containment based on the language of the percentages in the contract, if that helps. And we'll make sure that they'll never go past that.
So how would they invoice us? I mean, at this point, we don't know. So they're going to be invoicing us this magical imaginary number. And so let's say we shop. So we get halfway through, or we get to the end of our construction, we're going to owe them that difference. So I don't understand how the invoicing for this would work.
So the invoicing, Patty, is based on the work they've done that period. So they will give you justification of, say, in the month of, I don't know, November, they will give you an invoice showing you the work they've done and the amount. So it's based on the actual work they're doing. It's not total mystery.
Well, it is, because it's the 0.5% of the 32% of the total build, or however that works. So it's of the total build. So when we go to invoice, while we're invoicing on these numbers that are work numbers, so let's say it's a per hour, when we get to the end of this contract, there's an unknown amount of money that will still be owed based on how they are invoicing.
I'll let Stan explain that for you.
Okay.
So yeah, once we know that exact construction number, then our fee will go either up or down. It'll just be adjusted.
And how far into the project does it normally take before we get to that point?
We should know that right after the schematics are completed.
So actually, Stan, so a question for me, actually. So until we know that number, so let's just say hypothetically we put you on contract tonight, how do you scale your invoices now before we know what the ultimate cost will be?
Yeah, we'll just charge on whatever work we've done that month. So until we know what that number is.
Based on the hourly rates that are in your contract?
Correct, right.
Now, okay, that makes me feel better seeing that.
And where are those hourly rates?
They're in here.
Yeah, I'm asking where.
Stan, this is Melissa. Can I have you spell your last name for the record?
Page 22, Exhibit A, hourly rate structure.
Yes, it's SCHIMKE.
Thank you.
And hold tight, everybody. I have the public. Somebody wants to make a comment real quick. Go ahead, Horace.
Horace Carlisle, Carlyle. You know what? It's sad because this hospital board over the last umpteen years has spent hundreds of thousands of dollars. We're down to the point where it's where actually you've already invested huge amounts of money into a concept of a hospital or construction of a new hospital. It's you either have to pay to play or you get out. You've got some of the best credentialed firms talking to you. They're not trying to hustle you. I mean, I could sit here and look at where you spent $1.3 million on renovation of the clinic, and you got back what $600,000 of it. And we're sitting here quibbling over, if you don't do this, you're dead in the water. Yeah, I mean, I personally, I'm opposed to what you're doing. But you know what? I'm not going to try to impose my values or my thoughts because, hey, I can be wrong. But I know one thing, you guys are trying to act in good faith. You've got outstanding consultants, specialists. You've invested hundreds of thousands of dollars. And you're sitting back saying, my God, you're in the pot. Jump out now. You might as well shelve the whole thing and go back to where another concept. Thank you.
Okay, thank you. Stan, I've got a couple questions. When the EAPC first presented this to us a couple meetings ago, like a couple months ago, the figure of 400,000 was presented, and the timeline showed only about 2.5-3 months of participation by EAPC. Now, Russell said 24 months, and now we don't have that 400,000 anymore. Can you explain that to me?
Yes, our services covers all the way. I think Russell talked on a little bit about we're providing after schematics. We're going to stay on the project all the way through to the end. So we'll be providing QA, QC during the design development phase and the construction document phase, and then also during construction. So that's where that 2 years comes from.
Okay, and that's exactly what I was hoping for when we first got the presentation from you guys, but then that timeline didn't show that, and I said, remember I made that comment, I said, okay, so you want $400,000, and this is only getting us 20% of the project done. Who else am I going to have to hire in order to get me all the way through it? I want to keep the same team all the way through, so they know what's going on and what to tell our builders and that, and watch to make sure they're giving us what we have written down in paperwork. So that's what you're planning on doing?
Correct, yes.
Patty, anything?
No, I found their Exhibit A, so.
Tim, you got any other questions?
Nope, I'm good.
So, Don, let me throw one more thing in here real quick. It may be obvious, but it wasn't for me initially. Let's say theoretically the hospital at the end of the day costs $30 million. It's a $30 million effort. Well, this chunk for EAPC is inside that $30 million. It's not in addition.
Okay, so say it is 30 million. So the figures that are up on this on the slide are correct then? 30 million, 8.5% of 30 million, and then it's 32% of that. So you get 30 million times 0.085 times 0.32. So about 816,000. Is that right? Okay, 817,600 is what they come up with.
Correct. Yeah, that's what's up on that's the example that's in the contract. Yes.
Okay, and that gets us an architect that's going to help us design, and then we'll run it all the way through to the end, correct?
Okay, so I'll let Brett explain that, Brett or Stan. So it's a little nuanced in that regard, but.
You want to go, Stan, or you want me to?
You can go ahead.
Yeah, so I like to think of Stan's role as your advocate, overseeing they first translate the data from Whipley into a usable document that a design build entity can develop a facility, whatever they design, and we select that. What I think is prudent and really critical is that beyond developing that criteria document or that performance standard for those design builders to propose on, that after whomever is selected, you have your advocate, which will be Stan and EAPC, to make sure that what they're building is not just per code, but per the owner's intent. You know, whatever for performance guidelines that may be included. If you have that care manager advisor on board and they recommend, 1, 2, 3, 4 bays per nursing station, whatever the performance standards are, then Stan's firm will be your eyes and ears architecturally on the job to make sure it's done. QA stands for quality assurance. QC stands for quality control. And that's going to be their role during construction. QA, QC, making sure it's done in accordance with the district's guidelines. And I think it's a vital part of their effort. When they first looked, as you mentioned, Don, they were only developing a criteria document to propose to, but we didn't have that consistency, like you mentioned, of making sure it's carried all the way through. And we will always, and Russell mentioned the 30 to 50 million, we will always report to you in terms of total project costs, all encompassing everything. But Don, what I want you to clarify, Stan, what I want you to clarify is your proposal is a percentage based on construction cost, and we really need to separate those two. So when Russell said EAPC's cost will be a part of that total project cost, their 8.5% or 32% and 8.5% is going to be on that construction cost, which if the total project cost is 30 million, construction cost is going to be somewhere around 30% less than that. And I'm hoping I'm not confusing you by all this, but I do want to make that clarification. Stan, do you want to add that clarification also?
Yep, that's correct. Yeah. So our fee is based on, right, the construction cost, not the total project budget, right?
Any questions? I'm ready if you guys jump in both feet. Tim, anything else?
Oh, no, I'm good. I'll motion to accept the contract as presented.
I'll second that motion.
Okay, I have a motion and a second to accept the contract as presented. And I just want to, for discussion, I want to call our attorney tomorrow and make sure that they are in agreement with this. So based on their approval, I would vote to accept this too. So you want to, can you redo your motion, Tim, or to include that?
It's been bounced to him like 5 or 6 times. It's his final version. I'm pretty comfortable accepting the fact that I was involved in the process, and Russell says this was his final version. I'm comfortable accepting it as is.
Okay, I'm just saying because this is the first time I've ever seen this. How about you, Patty?
Well, it'd be great if we had like a letter from our attorney that said that he had seen it. So that would be something for the future for sure, considering that we just went through the whole situation that we just went through. So I am kind of gun shy with these contracts, especially when they are
open-ended.
Open-ended, yeah. So, but if you've got it.
I can forward you the email of Ted's last approval, or you can reach out to him. Either way, whatever you feel better with.
When you bring these forward, Russell, if you have consulted our attorneys, can you include their notes when you put this as part of our backup? And that way we know that it has been flown through. We, as you know, the contract that we just terminated, it had some big issues within the contract itself. And so I just don't want to see us in that situation again. This contract is rough because we know we have to have it, yet it's a blank check. And that's a tough pill to swallow. So if we had both of those things all settled for us, it would just, I don't know, make me feel better.
Yeah, from now on, I will definitely do that. I apologize for not doing that.
And I will hold my second to Tim's motion.
Keep in mind that when we do a lot of these contract negotiations, we generally have a trustee involved in the first place. That was me in this particular case. So going through the whole thing, and even the last one, Tom was on the line with us when we voted to accept the last contract, and it didn't seem to do us any better.
Okay, anything else?
Nope, no more discussion.
Okay, so if there's no more discussion, I have a motion and a second to accept this contract as proposed or as presented. And I'll call for the vote. All in favor, say aye.
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 Aye. Any opposed? Nancy, are you still on with us? I'm not hearing you at all, Nancy.
What does she ask to push?
Okay. All right. So any opposed? So I'm showing 3-0-0. So it's approved 3-0. And I want to call Nancy as abstained because I can't get her answer either way. You said aye. I hear you, Nancy. Thank you. Okay. I got you that time, Nancy. Okay, 4-0, it passes. Thank you.
Thank you, everybody. We'll keep you updated on how things begin and how we're going to start moving forward.
Okay, sounds great. All right, let's move on. Item number 12 for possible action, approval of the invoices for payment. Tim, do you get to see them?
I glanced at them, but I didn't see anything in depth. So as long as you guys are okay with them, I'm fine.
Yeah, we have two invoices, one for Lobbyet for $29.95 and one for Sixco for $5,000.
I make a motion that we pay the invoices as presented.
And I second that motion.
Okay, I got a motion and a second. Any further discussion? If not, I'll call for the vote. All in favor, say aye.
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 All right, passes 4-0. Any no nays out there, so we're good to go. Pay the bills as presented. All right, item 12 done. Item 13, general public comment. Second. Anybody?
Somebody.
Okay. Item 14, announcements. Second. Nothing more?
Nothing more?
Nothing more, Tim? Nancy?
No, thank you.
Okay, I'll just let the rest of the board know. I will contact the attorney in the morning, make sure
Just to confirm.
we're good to go, to confirm everything. Okay, if we have no other announcements, let's move on to item number 15. Adjourn.